Hello, and welcome to the latest installment of the Prematurity Alliance and the National Perinatal Association's Family Advocacy Network collaborative webinar series. We are so glad that you are here with us today. My name is Kira Sorrells, and I am the founder and president of the Prematurity Alliance, which is a network of organizations around the country. Each provide much needed support to families who are in the NICU, those who have graduated from the NICU, and those who have lost babies. We are a group of organizations actually that has been founded by or these organizations are run by a parent leader who had their own NICU experience themselves. I am delighted to be here today alongside my colleagues Crystal Grogan, who will be co-moderating today with me and works alongside me at Prematurity Alliance, and by Erica Goyer, who is from the National Perinatal Association's Family Advocacy Network. She's their Director of Marketing and is a very active family advocate. For those of you who don't know about the NPA's Family Advocacy Network, FAN champions collaborative relationships between families and the medical professionals who care for them. They bring together family advocates from every arena of maternal infant care to share their ideas and cultivate their talents so that we can collectively address the medical, educational, and psychosocial needs of families. And it was this commitment to families and collaboration that brought the Prematurity Alliance and FAN together to create this webinar series. Now, as you all know, November has been Prematurity Awareness Month, and throughout the month, you've no doubt seen some alarming statistics about prematurity. You have probably seen images of babies that were born well before they should have been, and you've probably read and heard some stories about families who have gone through this experience. Some end in tragedy, some in triumph, and others are still very much walking that path. So as a group, we thought it would be a good idea to kind of close this month of awareness by bringing you today's webinar, Voices of Prematurity. It is a panel discussion with members from both PPA and NPA who have been affected or impacted by preterm birth and mental health issues and have channeled those experiences through writing. So before we get into the webinar itself, I've got just a few housekeeping notes. One, to let you know that the webinar is being recorded. If you have to leave at any point or wish to listen again, we will be providing a link to the webinar in your follow-up email, so be sure to check your inbox. Also, as an attendee, you will have the ability to ask questions. You should have a chat box on your screen, and we encourage you to use that. We do have some questions planned out for today, but just wanted you to know that that is available. Also, if you have any technical issues, please let us know by using that chat box as well. Now, I'd like to start by launching a poll. We just want to see who's here with us today. So if you could take a minute, I'll leave that up for a few moments. And let's see who is with us today. Leave that up for just a few more seconds. Looks like almost everybody has answered. So we've got a wonderful mix of in-hospital parent support organization leaders, and community parent support organization leaders. So we welcome you and we thank you for being with us. I'd also like to welcome our panelists, each of whom has taken this life experience and transformed it into something that really is providing hope and encouragement and healing for many NICU families. First, we have Jennifer Daigle. She is the author of From Hope to Joy, a memoir of a mother's determination and her micro-preemie's struggle to beat the odds. Jennifer, thank you for being with us today.
Hi, everyone. I'm very happy to be here today and want to thank everybody who is joining us this afternoon.
Great. And we also have Allie Dunn. Allie is the author of I Was a Preemie Just Like You. Hi, Allie. Thanks for being with us.
Good afternoon. It's great to be here.
And we've got Andy Mail, who is the author of Go Preemies, which is a children's book, a collection of inspirational stories from the world's most famous preemies. Hi, Andy. Thanks for being with us.
Hi, Kira. Thanks, everyone, for including me. I'm excited to be here.
And we've got Dr. Sue Hall, who is a neonatologist and author of For the Love of Babies, One Doctor's Stories About Life in the Neonatal ICU. Hi, Dr. Hall.
Hi, how are you today?
I'm good. Thanks so much for being with us.
Yeah, my pleasure.
And rounding out our panel is Jennifer Moyer, who is the author of A Mother's Climb Out of Darkness, a story about overcoming postpartum psychosis. Jennifer, thank you so much for being with us.
Thank you for including me. I really feel honored to be here. Thank you for joining, everybody.
So let's get our discussion started. I want to start with you, Jennifer Daigle. Can you tell us why Prematurity Awareness Month is important to you and how your personal experience led you to write your book, From Hope to Joy?
Sure. Well, November in general is a month that everyone's kind of called to reflect and be thankful. But for us as preemie parents and any parents who really experienced a traumatic birth or a sick child, it means a great deal more. So for me, Prematurity Awareness Month means a lot of things, but a few of them are really being thankful that my daughter survived her extremely premature birth and being thankful to the doctors and nurses and staff that cared for her and the people who developed all the medications and medical devices that without she likely wouldn't be here. So it's that on top of spreading awareness and letting the general public know that who luckily didn't have to experience something similar, letting them know that it exists, and so maybe they can participate and encourage legislation and medication. And for me, the experience of delivering a baby that was on a cusp of viability that required life-saving therapies for several months, that would change anybody. But for me, her strength, my daughter's strength and success was remarkable. And I wrote my book because I wanted to share her story with other people to show them the reality of a premature birth and to spread awareness of what it's like, but also to show people that there's positive outcomes and they have reason to hope, because every parent in the NICU needs a reason to hope or they can't keep going. So that's why I wrote my book.
Absolutely. I could not agree with you more. And Jennifer, how many weeks early was your daughter?
She was born at 23 weeks gestation back in 2012.
And how old is she now?
She's 5.5. She's doing really well, a few complications, but overall she's doing really well.
That's fantastic. And could you share with us what was the one thing that brought you hope when you were in the NICU?
I think it was watching her progress. It was, and watching some other babies, really seeing how they were growing, and slowly over time, of course, with setbacks, things would be removed and medications would be reduced, and just watching that gave me hope that that process would continue.
Right. And that's one of the things that I love about even just your book title, From Hope to Joy. And of course, joy, why is that word title?
We didn't name her. I wasn't able to see her for several days because of my own complications, and I didn't want to give her a name until I could meet her in person. And of course, there's a lot of sadness and uncertainty, and when I finally got to meet her, I think I smiled for the first time, and that's where joy came from.
Oh, that's wonderful. Thank you so much, Jen, for sharing all of that. Allie, your book looks at prematurity from a slightly different lens. Can you tell us a little bit about what your experience was like about having premature twins? Were you high risk to begin with, or was this completely unexpected?
Sure. Well, I had a 3.5-year struggle with infertility and ended up finally conceiving my twins through IVF. And so we kind of knew from the very beginning that we were having twins, and the twin pregnancy in and of itself puts you kind of into a high-risk category. And then they ended up being born at 28 weeks, and they were in the NICU for 55 and 65 days.
Wow.
As they graduated from the NICU, they got a little bit older, and they really began becoming interested in hearing about their birth story and seeing pictures of themselves when they were babies. And from the very beginning, this always included discussions of life in the NICU, that yes, you were born early and you were very, very small and you needed additional time in the hospital to grow. And we always showed them pictures of them in their isolettes with all the oxygen and the medical equipment. And I always thought that it would be nice to have had a book to supplement these conversations that we were having. And so I set out to find a book about the NICU. Mm-hmm. I wasn't able to find something that I liked, and I was kind of specific in the criteria that I was looking for. I wanted something that was a very simple introduction to the NICU, that was developmentally appropriate for younger toddlers, and something that took this scary NICU experience and reframed it into a positive. So I couldn't find anything I liked, so I just decided that I would make them a book. So I wrote the rhyming text because I like reading rhyming textbooks, especially out loud, and I added the illustrations. I found a self-publishing company that would print just several copies of the book. And when the book arrived, my children really enjoyed it. We read it all the time to the point that they have the book memorized.
Oh, wow.
And as other people began to see the book, I got some requests from friends and family, oh, can I get a copy of the book? Where can I find a copy of the book? And so I thought, well, maybe I should just make it available to the public. If it's something that helped my kids, perhaps it can help others. And one of the things that I really enjoyed when my kids were in the NICU was reading to them. It was one of the few things that helped me feel normal, or like a normal parent, something that all parents do, reading to their kids. And it really helped me block out all that noise and imagine that I was sitting in our nursery at home and not in a hospital room. So I would have loved to have been able to read my preemie, a book about a preemie, when they were in the NICU. So hopefully this book can provide that calming, peaceful experience to help families escape in the pages of the book and enjoy that time with their children while they're in the NICU, and then certainly for years after as well.
Right, absolutely. So your initial intention was not to have this available to the public. It really was something that you wanted to do just for your children.
Yeah, really, it was just a little DIY project that turned into something more.
Yeah, that's wonderful. And I think it's really interesting. I also had preemies, and when they first looked at their pictures, they we're looking at them and saying, why does mine look different? What is on my mouth? What is on my eyes? Why do I look different than, my neighbor's baby? Did your girls have, they were quite small. Did they have questions like that, or were they just more inquisitive and didn't have that frame of reference?
Because both of their pictures looked kind of the same, I don't know that they were asking those types of questions, but I know that, like with my nieces and nephews, when they would look at pictures of my kids, it was scary for them. They didn't understand what was going on and why all the tubes and wires. So it's definitely a book that having those conversations and reading those types of books can even benefit children that weren't born prematurely, just to kind of understand and not be so scared.
And that's a great point, that this book isn't just for the preemies themselves to understand what their journey was like, but it's a great tool, I'm sure, to use with siblings and other children that are in the family that have no concept of what, a NICU is. I think that is just wonderful.
Absolutely, yeah.
So we're going to move on now, and Crystal, my co-moderator, is going to jump in and take over some of these next couple of questions.
Thanks, Kara. So glad to be here. I'd like to talk to Andy for a little bit. Andy, you have a very unique perspective, having actually been a preemie yourself. I think one of the questions that enters the minds of parents with NICU babies is, what will life be like after the NICU?
Yeah, Chrissy, it's a great question, and I can only, kind of really emphasize what Kira said and Jennifer and Allie in terms of some of these themes. Just by way of background, so I'm an adult preemie now, but I was born as a 27-weeker back in the 70s and spent 3 months in the NICU. And then in my youth, spent a lot of time as a part of cohort studies at Rainbow Babies and Children's Hospital in Cleveland. And so was, I'll call it an active preemie in the community when I was young. And the things that everyone just mentioned, I experienced. And I guess one caveat is, as we all know on the phone, there's a wide variety of outcomes for preemies, all with very different challenges, but challenges nonetheless. And personally, I experienced developmental delays that held me back in school. I have certain physical, repercussions from the time in the NICU, and just as I think Allie was saying, and Kira was saying, I grew up, pulling out that big binder my parents had of Polaroid pictures of me in the isolette and looking at it just again and again and again. And you balance that, questions that you get from outsiders about, why do you have this? Why aren't you more like that? Juxtaposed against what I'm very thankful for my parents are providing me is kind of a strong sense of pride in terms of being a fighter and getting through that journey, the NICU. So really balancing the two. And so when it came to, Go Preemies, and in kind of the volunteer work I would do in the space, I became aware, and I'm sure many of you have seen this, some of the famous names, some of the best world contributors who were preemies, and I thought to myself, man, I thought of really two things. One, what I have wanted my mother to have in the time in the NICU, those many months spent really alone. What would have been something great for her to have? And then likewise, frankly, thinking about myself, my 7-year-old self, and dealing with some of the challenges of prematurity as a young child. What would I have liked to have had? And that's kind of how the idea for Go Preemies was spawned. And I hope it provides families that now.
That's wonderful. Now, Dr. Hall, you also have a very different perspective as a former social worker and now a noted neonatologist. One of the things that we have the privilege of knowing very well about you is that your desire for every NICU parent to receive the psychosocial support that they desperately need. How did this become of such great importance to you?
Well, first of all, thank you for having me here. I think I just brought my social work experience with me into medicine and have always been concerned about how the medical experience affects people emotionally and in their social context. And I realized that providing NICU care was traumatic for me. For example, if I had a baby I was resuscitating in the delivery room and things weren't going well, you know, I'm a doctor, but how are the parents feeling about it? So I was equally as concerned of what was their experience and their journey as I was about taking care of their baby. So also I would say that a lot of times doctors are just focused on taking care of the baby, which is what I'm really trying to expand the focus from just the baby to the family. But I had a colleague, for example, one time who said it was just her role to take care of the baby and tell the parents the medical information, and sort of what happened after that wasn't her concern. So in this example, she went in to tell some parents that their baby had trisomy 18, and she basically did it in a very medical way and just said, you know, the chance of survival and when your baby's going to pass away and the first year of life and on and on and on. And afterwards, the parents spoke with the rest of the staff, and they spoke with me because I was the medical director at that time. And it just reflected that that doctor hadn't really been sensitive to how she was presenting the information, in that they had another child in the room and they were talking about this baby's death. And you know, it's easy for me to see how parents are affected by information that we're giving them, and I wanted other people, other doctors in particular, to be able to think beyond their narrowly defined role of providing care to the baby to providing care to the whole family and considering how the family is dealing with everything that's going on.
And Sue, it's Kira. How long have you been in practice?
About 30 years.
And obviously a lot has changed in neonatology in 30 years. You know, I've heard stories, in fact, of my own mother. I was actually born prematurely myself, and she was told, just go home and we'll let you know when the baby's ready to go, to come home to. And that's obviously not the case anymore, but are there other just striking differences from when you first became a neonatologist to what you see now in how you practice?
Well, I think that parental involvement and parental feedback has been a major force in causing doctors to deal with parents. And I go back to, I don't know if it was the late 70s or early 80s, when Helen Harrison, who was one of the first preemie parents to write a book and sort of speak out about how doctors weren't involving parents in decisions about babies. Doctors were just kind of playing God and deciding who should live and who should not live. And Helen Harrison and other parents spoke up, wanting to have some input into the care of their babies and wanted to have collaborative decision making. So that kind of started neonatologists down the road of working with parents in a different way. And I think that the work that you are doing in the Preemie Parent Alliance is just furthering that movement to see parents more as collaborators than as people who are just waiting to take their baby home on the day that we call them and tell them the baby is ready. So I hope the
Right.
message is getting out there to doctors, and I think the patient satisfaction movement has probably had some impact on how people are practicing, because we're getting judged and graded now on how parents feel about how we interact with them.
Exactly. And thank you for being such a champion for families. You've made a huge impact in the lives of so many out there. And I wanted to ask you about your book. So was your book, was that written for your colleagues so that they could kind of understand a little bit better about what these interactions are and these parent experiences are? Or did you write it for families? Or did you have a specific audience in mind when you were writing it?
Well, I wanted to write it for both audiences, but I would say one of my primary reasons was for parents to understand how doctors are thinking. So I read a lot of medical memoirs and preemie parent memoirs, and I would read things like, you know, the doctor was so horrible and came in and said this and was so cold and unfeeling. And when I would read what the doctor said, I would say, well, I understand why the doctor said that, and I want parents to understand why the doctor said that. And usually it would be something about discontinuing care or poor outcome or information that was negative, that was part of a balanced viewpoint for making an informed decision. In other words, we cannot always be 100% positive when many parents would want us to be. So I wanted to portray our difficulties and challenges in our own decision making and in how we communicate with parents, so that parents understand why sometimes things sometimes seem like doctors are cold. And I just want to differentiate that bad news, quote unquote, can be given in a more positive way, so it doesn't seem so cold. So that's one of the issues that I'm working on with doctors. But I just wanted parents to understand the doctor's point of view a little bit as well.
I think, and you know, that's something that's really important. And obviously, you know, we as the Preemie Parent Alliance and our members, we are trying so hard to give parents a voice. And when we, you know, speak with providers, we want to bring them into our world. But it is important for us to understand your side of the bed also. So if anybody hasn't read Dr. Hall's book yet, I would encourage you to read all of them, but it really is just a different perspective that we don't see a lot of. So thank you so much for all the work that you're doing to bridge that gap that we've had for quite a while.
Yeah, I'm pleased to do it.
Yeah. And I'm going to move on now to Jennifer Moyer. Now, your memoir chronicles your experience with postpartum psychosis. Now, we hear a lot more about postpartum depression or anxiety or the baby blues. And I actually once read in an interview with a memoir writer, and she said that writing memoir is like living twice, both painful and elating. Did you find that to be true in your experience? And also, if you could, just for our audience, can you explain briefly the difference between postpartum psychosis and postpartum depression?
Yes, I do agree to some extent about that statement. I personally have always enjoyed writing. I was journaling since college, and I found it to be more healing. Now, of course, when I gathered all my medical records to write the book, that was a little bit difficult to see some of the records, and that was a little more challenging, but I overall, it was a healing process for me, and what triggered me to actually put it in writing was in 2003. My mother died tragically in a car accident, and that brought home to me what is happening with these illnesses when suicide is one of the leading causes of death postpartum. I was like, moms are dying from this, and I wanted to get the story out to more. And so that was really why I put it in writing. And it was, primarily, it is very misunderstood. We've had more awareness in more recent years. More women are speaking out about it and talking about it. And there's actually the spectrum of perinatal mood and anxiety disorders. So postpartum psychosis is considered the rarest of those. And although it's 1 to 2 out of 1,000 births, generally is what the statistic is quoted, there's some speculation it could be higher, especially because trauma is often associated, a past trauma can be associated with psychosis. So the primary difference would be, it's a medical emergency with postpartum psychosis. In my own personal situation, it came on very suddenly. I compare it to a tornado. So generally, there needs to be medical intervention right away. And the lack of sleep was a huge factor for me, which triggered everything. And so that is the primary difference. With depression and anxiety, the symptoms can be severe also, but generally, the mom can identify that there's something wrong, and they just, they can more easily seek help. But with postpartum psychosis, because it can come on suddenly, they may not be able to differentiate that, and you can have delusions or hear things or see things, but the sleep deprivation is huge. And so I found writing the book to be healing primarily. I wrote the book actually in a shorter amount of time than it took me to get it published, and there were many times I was willing to just give it up, and I would put it aside, and then something would bring it up, and I would be like, okay, I'll try again, and query agents, because I had no resources to self-publish, and I really wanted to try to find a traditional publisher because of the topic. I thought it was important that it was picked up by a traditional publisher. And so through that process, I finally, in 2010, was like, make it happen or take it away. And through that process, I found a literary agent that saw the importance of the story and worked with me. And I was able to get it published, and it was released exactly pretty close to a month after my son graduated from high school. So the timing was very good, and because mental health is so misunderstood, I think that journey, it's hard for people to want to address it, but perinatal mood and anxiety disorders are one of the most common complications related to childbearing, and it's finally, I think there's much more being addressed now. So that's good. I mean, it's not good that there's lives still being lost and so much misunderstanding, but it's good that we're talking about it and addressing it in a much more proactive way.
Yeah. And how does postpartum psychosis present? You said it comes on very quickly. So does that mean, 1 minute you're fine and then the next minute you're hearing things?
Well, in my case, and most cases, there might be some precursors. The fact that I wasn't sleeping, but I had just a sudden fear that came out of nowhere, which would most likely be identified as a delusion, but it feels so real that I was believing that someone was trying to harm me and take my baby. So, it may present differently for other women, but generally when you're in that fight or flight state of mind, which often happens because there's definitely something wrong, but you don't necessarily identify it consciously, to be able to seek help. Right.
And how long of a period of time went by for you from when you kind of first had these symptoms to when you were able to get the help that you needed?
Well, for the fear, what happened, I went 3 nights without sleep, and it became a medical emergency. And as I, chronicle in the book, But looking back, I may have had some early symptoms, but my family and I didn't even know postpartum psychosis existed. I mean, we heard a little bit about depression, but you know, didn't know it existed, so didn't really know what to be looking for, if it could even happen. And so the actual, you know, I had a little bit of obsessive compulsive things happening when he started sleeping through the night. And, you know, looking back, maybe that would have been something that I could identify now, that maybe I, you know, not being able to sleep when he's able to sleep, that was a big factor as well. So, so, you know, there are things now that I see looking back that maybe if I knew, or my, you know, my family knew, maybe there could have been an intervention sooner.
Right. Well, thank you so much for sharing that and for writing the book that you have written. It's so very, very important, and I think it's also important to mention that there is no shame in admitting that you need help, or realizing that you have a perinatal mood disorder. I think that it's very hard sometimes as a mother to admit that you need help. So we thank you so much for your book. I'm going to go back for just a second to Jennifer Daigle. You do a lot of work with NICU families right now as a peer mentor, and you've even trained staff in how to help families begin to journal in the NICU. So can you talk to us a little bit about why journaling is such an important tool for parents, and how that played in to your own experience?
Yeah, I never journaled before I had my daughter. I started a journal on a sheet of paper that was given to me by a nurse the night she was born, because I couldn't go and see her, and I guess you would say I was having an emotional episode. I was angry and irate, and I wanted to meet her but couldn't physically. I know now wasn't allowed to go for a reason, because I wasn't stable enough. But she gave me a piece of paper and told me to just write everything down the whole night, and I didn't sleep the whole night, and I wrote and I wrote. And I really am thankful for that moment, because then every day for 121 days, I continued to write about my daughter's stay, about her progress or lack thereof, medications. But not only that, I wrote about, you know, my pregnancy and feelings about it ending early, and other emotions, and about my other children at home and what they were doing. And I just kept writing, and I kind of used it. I like to use the phrase, it was my weapon against misunderstanding, because it helped me understand myself better, helped me understand what was going on with my daughter better, because I would write down what the doctors and nurses said, and I wouldn't forget or be nervous that I had forgotten something. So I think it's really important for the nursing staff and the doctors to encourage it. I mean, not only can it help you keep track of your baby's health and progress in your own words, which is much easier than reading a chart, but it also will help you make better decisions, because you can later on or at night go back and look up information, so you can participate with making decisions better with your baby's medical team. But also, in what we're just talking about, research does show that expressive writing can be very therapeutic, and writing about traumatic or stressful emotional events really can improve people's psychological health, and sometimes their physical health. And I also really liked it, which it helped me write my book. It was the reason I wrote my book, because going back and reading the journal, even periodically while your baby's in the NICU, and of course afterwards, really does allow you to see the progress that's been going on or has been made. And I think that itself can help you heal, and also just writing in general and writing everything down and then reading it. It was kind of like a free therapy for me at the time, and I'm so glad that I did it, and I really do recommend that everybody does that.
Yeah, you said something just a second ago that just instantly resonated with me, and it's amazing how things will come to you that trigger memories. And I remember one of the neonatologists talking to me about one of my girls and saying, her progress is not going to be measured in days. It might not even be measured in weeks. Her progress is going to be measured in months because she was so critical. And you're exactly right. Being able to go back and say, okay, yes, this last week didn't seem like anything changed or anything improved, but you can look and you can see those little small changes or those tiny improvements that did occur. And you talked earlier about how important it is for families to have hope, and this is a wonderful tool to help them. What could staff do to help families start to journal if that's not something that they already encourage in their unit?
I mean, it would be ideal if that could be part of the welcoming package or folder that's given out when parents, first have their babies admitted to the NICU, but not every hospital can afford that. There's a couple of great ones out there. But even just a paper, I mean, I have a template of one, but there's so many out there, and just even a template where they could copy, one for every day or some version of that to encourage it. And if they have the child life staff also encourage it, that could be part of a different program where they walk around and they talk to the families about it, or the child life can pass it out. But even if you just pass out notebooks, mine was just a regular plain notebook. It really could be anything like that.
Mm-hmm. So it doesn't have to be formal in any stretch, but just being given that idea. Sometimes we need to be told, hey, here's something you can do while you're here with your baby. So that's definitely something that I hope every NICU will adopt, and those that are organizations and advocates that work with the families in the capacity that a lot of our members do, that they really think about including that as part of the work that they do. Dr. Hall, what other types of self-care practices can parents engage in while they're in the NICU? So often we don't want to leave our babies, so we won't go to the support group that meets in a different room. Obviously, something like Jen was just talking about with journaling, that's something you can do at your baby's bedside that is helpful for you as a parent. What are some other ideas that staff could encourage for parents to do?
Well, we always start by encouraging the basics, which are to be sure that you're drinking enough, eating enough, and getting enough rest. And we often tell the parents that they need to take care of themselves now and get healed from their delivery, physically, put back together, so that when their baby comes home, they'll be strong and ready to take care of the baby. So a lot of times we see parents who come in after delivery and just don't want to leave, and their condition kind of deteriorates, and they get so worn out, and they end up back in the ER with a medical complication or something like that. So physically taking care of yourself is very important. Also, I would say it's important for parents to try to mobilize their own support networks, because they're going to need support, or they're going to benefit from support going through their NICU journey. But they do have to be a little bit careful of how they involve their family and friends, because sometimes family and friends can inadvertently or unknowingly make parent situations feel worse. And that might happen if family and friends be like, oh, don't worry, everything will be okay, or, get over it and move on, some of these sort of glib responses. So if parents are finding that their own support network is not buoying them up emotionally, then I would encourage them to ask to speak to the social worker, and also to ask for a peer mentor. As you said, parents may not want to leave their baby's bedside to go to a group, but if they had a peer mentor that could come visit them, or with whom they could text or call or talk with on a Facebook group, somebody who's been through the journey that they've been through, that can help them learn how to cope with it. The other thing that we would tell parents is to don't be afraid to ask for help. from your family and friends. So if you need help with food for your family or transportation to and from the hospital, help with childcare so that you can spend time with your baby. I mean, balancing everything that new parents have to balance in addition to the NICU experience is a lot. And this is one of those times when people simply can't do well on their own in every instance.
Right, for sure. And kangaroo care, I mean, that's something that's not just beneficial for the baby, right?
Right. The kangaroo care absolutely has been shown in numerous studies to decrease parental anxiety, to decrease depression symptoms, to improve bonding. And I was just talking about this morning. At 10 years of age for the child, children who participated in prolonged periods of kangaroo care with their mothers during the NICU period had all kinds of better outcomes, including better cognitive outcome, better executive function, so decision making, but also importantly, better reciprocity in their relationship with their parent. So kangaroo care, so good for the baby, so good for the mom, and other things that I would encourage parents to do. You could label it self-help, or you could label it becoming empowered, but asking for what they need and want in the NICU, so asking to participate in rounds, asking for care conferences with their baby's medical team, ask to room in, all of those things will help parents feel more in control of the situation and actually go a long way to decreasing anxiety and depression as well.
Such good information that just, I mean, it can't be repeated enough, I don't think. So I'm going to jump back over to Allie and Andy. You know, you are our two children's book authors on the panel, and there are parallels in your books that speak to preemies in a way that lets them know that they aren't alone. And those that work with NICU families know how important this is for families to realize. But why is this also important for the children themselves? I want to go to you first, Andy, because you mentioned a little bit ago that as you grew up, there were differences that you noticed. So what was that like? And did you often feel out of place? Did you ever get to a point where you knew you weren't the only one?
Yeah, that's right, Kara. I mean, I do acutely remember that as a young child. I mean, I was like I said, held back in school for a year, and so a year older than all of my other classmates, right? And I would get questions all the time, you know, why was that the case? And you know, we joked that I never learned to tie my shoes in kindergarten, but you know, when you get questions like that many times, regardless of what the real answer is, the fact that you get the question a lot, you know, affects you. And I have you know, certain physical things, scars and such that are a result of the NICU, and personally, I'm very proud of them. But again, you get questions, and you know, when you're a young child, that just makes you question. You know, is this a good thing or a bad thing? Is this something I should be ashamed of, or should I have pride in? And that's like I said before. I'm so thankful to my parents for framing the experience as a positive one in terms of being a fighter. And so when I think about preemie children, you know, you think about most kids who, you know, face complications. They look to, you know, sports heroes and superheroes. And what I realize in kind of thinking about the book is, you know, as preemies, we have our own real life superheroes. You know, these are some of the world's greatest contributors. You know, people who were born 2-3 months prematurely, and you know, went on to achieve phenomenal things. Now, that's not to say that, you know, all of us preemies are going to, you know, become, you know, Picasso or Mark Twain or Anna Pavlova or anything like that. But the point is to give, just give the preemie, give the child just that little bit of confidence, based on kind of referencing those superheroes, just give you a little bit more confidence so that in whatever situation you're facing, right, and it's all relative, just to be able to think to that and take confidence in that alone to help you get over your own personal hurdle, just that little push. And so that's, reflecting back on my experience, that was a motivation for, again, the book, and I hope it's providing that same feeling to my young preemie friends.
Yeah, well, I can tell you firsthand that I've looked at your book and read your book with my girls when we first met you a few years ago, and it was right about the time that we were discovering that one of my daughters has sensory processing disorder and auditory processing disorder, a learning disability with math, and so school is a challenge for her. And it was, she was wondering, well, why am I different from everybody else? Why don't I understand and everybody else understands? So being able to show her, well, look at these people that were preemies, and it was very empowering for her. And I often have to remind her and just pull the book out, even still. And Allie, one of the things that Andy said is is pretty much what you have done for your kids. You have framed the experience for them in a way that will empower them. And I think that that's really, had you ever thought about it that way?
Well, I think maybe we've normalized it in our house almost too much, because sometimes when we're out and about and we'll see a baby, they'll ask me, how long was that baby in the NICU? And then I have to explain that not every baby starts in the NICU, that some babies get to go home right away. So we maybe have talked about it a little too much. But yeah, the goal of the book was to give my kids and other kids just a character that they could identify with. And if they could identify with that character and still accept and love that character, then they could accept and love themselves. And if a child believes in themselves, then I think that they can accomplish anything. So hopefully this book can be an educational tool to help children recognize the differences in themselves, and still be willing to embrace that and embrace differences in others as well. Right.
That different doesn't mean bad, or and I think that's one of the challenges that I've experienced as a parent of preemies is helping my children to embrace that. So I appreciate that you and Andy have these wonderful books that we can draw on for them. And Jennifer Moyer, I think my favorite photo of you that I've seen is the one that we used in here in the webinar, where you are holding a sign that says "You're not alone." And how alone did you feel during your experience, and what helped you realize that you were in fact not alone?
Well, I recovered once I got the correct diagnosis of postpartum psychosis, I recovered fairly quickly, and I had a lot of support from family and friends. But the trauma and everything that I'd been through led into depression and anxiety, and it was compounded by the fact that I had not ever talked to anyone that had gone through postpartum psychosis, because it's rare. And you keep in mind this happened before the internet was what it is today. So my son was 4 when I learned of Postpartum Support International, which is a nonprofit helping to increase the awareness and prevention and treatment of perinatal mental health. And I started getting involved because my frustration and righteous anger, I call it wasn't really anger, like, that's not maybe the right word, but motivation probably is a better word, to help and make a difference when I learned about postpartum psychosis and all the other spectrum of disorders, that to do something more. So it was then that I through that organization that I started to meet others that had been touched by postpartum psychosis. And that was years ago, but it's only been a couple years at an annual Postpartum Support International Conference in recent years that we had the first survivor postpartum psychosis support group. And that was wonderful. There's so many that are touched by it that just have no outlet. But there's also another amazing organization called Action Postpartum Psychosis Network, which is based in the UK, but they do have a health forum as well for those that are touched by postpartum psychosis, and that's online. So there are much more resources, but I felt very isolated because for many years, even though I had wonderful support from my family and friends, because I hadn't actually talked to anyone. And I think one of the themes the panel's been discussing, whether it's preemie or perinatal mental health issue, is the need for support. And I think, peer support is so important, and I think it makes a huge difference, because when you can talk to somebody that has been through a similar situation or can relate to something that you've been through, it really helps in your recovery. And I think that is, probably the theme with this panel, is how important support is no matter what your situation.
Most definitely. And if anybody needs any medical literature to speak to that point, let us know, because Dr. Hall has quite a library of medical literature references and can certainly help in that point. And I just couldn't agree with you more about peer support. It was certainly that was something that we hear all the time when we speak to families who have had traumatic birth experiences, who are in the NICU, have lost a child, is just knowing that they're not the only one, and there is something different in being able to speak to someone who, of course, everyone's experience is uniquely their own, but when you have similarities that you don't have to explain or feel ashamed about, especially when we're talking about perinatal mood disorders, because there is shame that keeps us from sharing, I think. Well, I'm so thankful that those resources exist. Thank you for sharing those, and we will make note of those in our follow-up email after the webinar. So I'm going to ask Erica Goyer if you could let us know if we have any questions that have come through. We have a couple of final questions for our panelists, but I just wanted to check in with you. What have we got?
Yeah, absolutely. Well, first, I'm so glad we're having this conversation. This is such an important and rich discussion to be having, and from so many smart perspectives. And, Kira, you were talking earlier about the idea of, how do we talk to our children, or how do children at different developmental stages understand what this experience that we had around their birth means. And, Jennifer Moyer, especially, I was thinking about, you said, that your book was being published, and so you're at this point where you're sharing your story in a very, public sort of way at about the time that your son was, a young adult. And so I'm really just, curious about, because I talk to my children about these things and try to talk to them about mental health and stuff, but what sort of conversations have you, if you want to share, you and your son had around this? And if you don't want to share, then what generally do you think is useful for people to talk about when it comes to perinatal mood and anxiety disorders?
Well, thank you. That's such a great question. For us, therapy saved our family, our lives, and I am such a strong supporter of getting family therapy, because my son, there were periods of recovery throughout the years, but he was in therapy, or we were as a family, but for him, it helped normalize it. I had the family therapist we had for many years until he finished middle school, related the situation that I still had to deal with some challenges, with diabetes, or more recently I've heard of epilepsy, or things, you know, to normalize it to something that you could understand, that you have to manage your mental health throughout your life. And the interesting thing is, you know, towards the end of middle school when he was complaining and, oh, I don't need it anymore, you know, we transitioned out. He has not read the book yet. I gave him a copy, but he was, you know, he's in college now, and he's like, Mom, I just don't, you know, because it's going to be part of his journey too. And, you know, whether he reads it one day or not, he started out, I think this is a testament to, he started out studying business, you know, public relations and all that. And after he got into some of his classes, he realized what he liked better. So he's actually finishing his bachelor's in psychology. And although he doesn't want to be in private practice, he's going to get a master's. He's planning to get his master's and possibly go in the military to help him pay for that. But he, you know, it impacted him in a way that he, you know, he has that nurturing, that spirit, and he's actually working at a autism center with kids with autism. So, you know, we maintain our cars sometimes better than we maintain our families, and, you know, getting the right therapy is so important, and getting someone that you can connect with that can help transition. And I just, you know, it's amazing to see how he's turned into such an amazing young man despite all the challenges we've had over the years.
Thank you.
And what about you, Jennifer Daigle? How have you spoken with your daughter about being a preemie and what that means, or has she been curious? Because you have 3 other children that were all term babies. Is that correct?
Yes, that's correct. She knows because there's one picture frame that's in our main living area, and it has 4 pictures of her in the NICU, like with my husband's wedding ring and my first kangaroo care, and then another one of her a few days old, so she sees the tubes. And she's aware because I bring her back to the NICU all the time. I'm not sure that she understands much, but she will tell you when you ask her why we visit the hospital that she was born too small and too early. I don't know that she knows much more about what that means because she's 5, but she knows that that's what happened to her, and that's really all we talk about with her. The other boys, of course, that's a different story. That was a little traumatic on them, but
right. Yeah, I think that's really a topic for. I was going to say that's a topic for a whole nother webinar, I think.
Yeah.
Because the other members of the family that are affected by a preterm birth.
Yeah.
Well, thank you. So we've got a little over 10 minutes remaining with our time today. So I'd like to ask all of the panelists, and we'll just kind of go down the line to have you answer this question. So I'll start with you, Jen. You said that you had never journaled until you were in the NICU. So you didn't have a background in writing or a master's in English or anything, I'm assuming?
No, I was a science major in college, and I'm a science teacher, so I had no formal writing experience. I'm a very factual writer. So for me, I definitely needed an editor because I write factual. I don't make it as much engaging and whatnot, and she helped me with some of that. But it was our story to tell, so it kind of, you know, it was written more as a journal because I took my journal and used it, but I have to say it wasn't difficult as far as typing everything. It was more difficult emotionally to write everything out, but I really do believe it helped me heal along the way, so I do recommend it.
Yeah. And what about you, Allie? Had you had any experience with writing before you took on a children's book?
No, I hadn't really had any creative writing background. I certainly wrote more academically for my job. I worked in higher ed, but I would think if you have a unique voice and a story to tell that hasn't been told before, and you feel compelled to write something, whether it's part of a healing process for you or you're writing just from the inspiration of a situation, I say you go for it. And as Jennifer said, you can hire someone to help you with the more technical aspects aspects of the book. You can hire an editor, you can hire an illustrator if you need help with those things. And you can't replace your own experience. So that's something that I think if you have that voice and you want to tell your story, I think you should tell it. And with self-publishing, it really allows access that anyone has the opportunity to tell their story. So.
Right. That's wonderful. Now, Dr. Hall, I know you have extensive experience in writing for medical literature, but this had to have been a little bit different. So how is that different, and what made you, believe in yourself that you could write something differently than what we typically would see in a medical journal, for instance?
Well, let's see. This was the third book I had tried to write. The first two, well, one was sort of a novel, and the other one was a nonfiction, and it really required a shift from left brain to right brain, because scientific writing or medical writing is so left brain and so precise and big words and all that kind of stuff. And to make a book like this engaging, it really had to be a lot more emotional. And I feel like it was a great outlet for all the emotional stuff that I feel about being a doctor. And before, when I had tried to write a novel, it of course was a medically based situation, and it's just kind of a way to work out your feelings. So this was a good format for me because it's 16 stories and each one is rather short and self-contained, so I could get the whole story arc in there compared to a novel. So I really enjoyed it. I would like to continue to do more writing of a non-academic nature in the future.
Yeah. And Andy, what about you? Did you have writing experience, or do you have a background in writing before you took on the children's books?
I have professional writing experience, Kira, but not so much as it relates to children's books. So I was able to, do a lot of the research myself and design the book myself. But what I actually needed was an illustrator. And a fun fact about the book is that I interviewed dozens of illustrators and got lots of samples. And the illustrator I ultimately chose to use discovered that he himself was a preemie during the illustration process. He showed his mother what he was working on, and she said, "Oh, well, you were born prematurely also." He's a 32-weeker. So that was a very fun and fortuitous. Yeah, very fortuitous thing for us. So
yeah, and that wasn't an accident.
Yeah, exactly.
That's wonderful. And Jennifer Moyer, what about you? Had you had any formal writing experience prior to writing your book?
Well, my professional background was marketing, healthcare marketing primarily, and so I had writing experience from that perspective. And of course, I was literally thrown overnight into mental health all those years ago and never really imagined. I mean, I enjoyed writing, and I actually had started journaling as a requirement in one of my college classes, but I kept up with it over the years, and that really helped in the writing process. But I didn't have any plans of writing a book. It did come to me, like I said, that pivotal moment in 2003 when I'm like, I got to get this more, to reach more. And some of it came pretty easily, and then I did have to work with a creative editor. One of the things, the agent told me was I originally wrote in a timeline fashion, and then we had to go back and kind of, work on the storyline, not changing anything, but necessarily making it in a readable novel kind of style as a memoir. And she said that, that's a logical way to start. So I would encourage anyone that's listening that just, whether they want to write to publish or they want to write just to share their story, with their family and friends or whatever, is, those journals, especially to try to do those, because when you go back, the timeline really helps you remember things. And And, the other thing to encourage is just don't ever give up, because, I can't tell you how many rejections. I've had so many rejections. And then when it came together and, it was just a small publisher, women's health publisher, that picked up the book, just don't give up, and like I said, whether it's because you want to get it published, which can be challenging, or just to share. I think everyone should share their story in some capacity with family and friends, and just don't give up.
Wonderful, wonderful advice. So just quickly, let's go down the line one more time. And if you could just tell us, what projects are you working on? Do you have plans for another book? What about you, Jen Daigle?
I do. We have a children's book that I co-authored with another PPA member, and it's almost ready. It's being illustrated, so hopefully by the summer that will be out. So we're excited about that.
Oh, wonderful. And what about you, Allie?
Yes, I'm excited to announce that I have another children's book coming out in early 2018, and it's called One of Two, and it's a twin story about individuality.
Fantastic. And Dr. Hall, I know you stay very busy.
Well, my current project, as you well know, is that I have collaborated with you and PPA members and members of National Perinatal Association, including Erica and Crystal and Cheryl and some of the other people who are on the background of this call, to produce a staff education course which will help nurses and neonatologists learn the skills necessary to provide NICU parents with the emotional support that they so greatly need and desire. So we are launching that in January 2018, and we just couldn't be more excited about it.
Yes, exactly. And Andy, what about you? You've got a kind of a new feature with your book that we've heard about.
Yeah, this is my only book. Most of my time will go to volunteering in space, but we will be. We've got it completed. It's an app version of the book, and so all of the illustrations come to life and are animated, and each character is actually voiced by a professional actor who sounds just like those characters. So it will be available for free in the App Store, and it's a fun toy for young preemies.
And when can we expect that?
Before the end of the year. It'll be in the App Store.
Oh, great. Wonderful. And what about you, Jennifer Moyer? What other projects are you working on, or do you have plans for another book yourself?
As much as I probably could write another book, it's not something I have pressing. I really feel like my story in this book has a longer life. I mean, it's kind of like birthing a baby. You want to get more. There's more people that I think will benefit from reading it, but I'm also focusing more on advocacy as far as involved with a collaborative in my state that is addressing perinatal mental health at the state level. And just the group that I had met with years ago, or a couple years back, the survivors, we have a core group, and we're trying to provide support and hopefully have postpartum psychosis addressed in a much more proactive way, instead of just dealing with the tragedies when they happen that are rare, but to hopefully bring more support and resources in the area of postpartum psychosis.
That's wonderful work that you're doing, and wonderful work that you're all doing. I just can't thank you all enough for being with us today. And to the audience, if you have any additional questions or questions that you think about later, you can reach out to all of our authors on Twitter or Facebook, and through the National Perinatal Association and Preemie Parent Alliance social media channels. We'll be posting all of those links for you so you can get right to the authors. I want to thank our audience for joining us. And if you want to purchase any of the books by these authors, which if you haven't, I highly, highly encourage you to do so. They're wonderful, make wonderful gifts with the holidays upon us. And again, we'll be posting that information on our social media. So before we go, we do have 3 final announcements. Erica, can you share a little bit about what NPA has coming up in March?
Yeah, sure, absolutely. Well, first of all, again, I have to say, I mean, out of these experiences, I think maybe none of us would have wished for had we been given the option. I mean, just what an incredible community and an opportunity we have. The people that we meet and get to talk to and the conversations that we get to have around what's happened to us are so affirming, and I'm so grateful for everybody's help and collaboration. I mean, every time I'm overwhelmed by, you know, how lucky we are to have each other and to have these outlets. But along those lines, you know, in March, the National Perinatal Association is going to have our 39th annual conference. We're going to be in Loma Linda, California at Loma Linda University's Children's Hospital. And what we're going to be talking about is something that's very relevant right now to national discussion, which is substance use, and whether it's opioids or nicotine or alcohol or so many of the other things that have become public health concerns. We're going to focus on discussing substance use around the perinatal period, around pregnancy and parenting. And I'm really excited about this because, you know, we know how to best care for these families. We know from so many amazing researchers and advocates and care providers what people need, and yet there's still a disconnect between what we know works and with what actually happens. And so we're going to get together March 14th through 16th to talk about ways to better support each other as providers and parents and families, and how we can take a situation that, while not ideal with substance use or substance use that's, you know, feels out of control, like misuse, that we're going to find ways and discuss ways to have that be a temporary treatable condition and to preserve families and to have a healthy community. So if that's something you're interested in or think you might be interested in, we'd love to invite you to join us. And if not actually there in California in March, certainly there are so many ways to get involved and contribute to what's an important public health initiative right now.
Absolutely. And Dr. Hall, briefly, she mentioned the psychosocial support for the NICU, caring for babies and their families, the NICU staff education course that we've collaborated on with National Perinatal Association, Patient Family Care, and Preemie Parent Alliance. And you can go to mynicunetwork.com to learn more about that. And then finally, the Preemie Parent Alliance will have our 2018 summit in September of next year in Falls Church, Virginia, and we'll be opening our call for abstracts in January. And we welcome abstracts and topic ideas from anyone and everyone who has an interest in maternal infant health. So I just want to say thank you once again to our panelists. Thank you to our colleagues at National Perinatal Association and to our audience. We appreciate you spending time with us, and we really, really appreciate the work that you do for families each and every day. So I hope that you will join us next time when we have our next webinar in 2018. Goodbye for now.
Thank you.